We're wanting to show you guys a little bit more about trachs and how to take care of those. Before providing trach care, you do want to provide suction to your patient just to make sure there's no irritation at that airway with secretions before you are doing anything around that airway. To do this, you're going to want to have a face mask with a face shield. And then there are 2 or 3 options on your unit to choose from. This is the standard suction catheter of choice. And then you also have some other kits. This one has sterile water and sterile gloves, and this one is just sterile gloves and a catheter. The catheters are all the same size. Whenever you are applying suction to your patient via your trach, the amount of catheter that should go into your patient's airway is really equal to the size of your inner cannula. So when you are suctioning your patient, you are really only looking to clear about that much catheter in order to clear your patient's airway. Anything that enters the trach needs to be sterile. If you are opting to use this red catheter, there is a way where if you have clean hands and this is sterile, we are just not going to touch that portion of the catheter, and then we can still apply suction and suck out of our patient's airway without ever having to touch or contaminate that sterile catheter. You always want to pre-oxygenate before, suction out at 10-second mark. Trach care is a shared responsibility between nursing and respiratory therapy. If you can do your best to communicate if you have done the care, that would really help the team in general. Trach care is supposed to be done at minimum twice a day. So day shift and night shift should both do trach care. You might even need to do it more often if your patient is having excessive secretions. Please be diligent in checking your orders. There are some physicians that require very specific inner cannula changes. If you are looking at your trach, there are a series of letters and numbers displayed on the flange of this trach. This is telling you the size. It's also telling you whether or not there is a cuff and if the inner cannula is reusable or disposable. These numbers and letters correlate to what you would see on the box of your trachs. We no longer use hydrogen peroxide. If you must use hydrogen peroxide, it has got to be diluted and then rinsed off the skin. For routine trach care, we prefer you to use normal saline or sterile water. Your choice. We have a trach care kit. It does not have everything you need in it. You might need to grab additional sterile trach brushes. You would need these if your trach had a reusable inner cannula that you were going to clean. Inside the trach care kit, you've got sterile gloves, a drape, split gauze dressing, dry gauze. These are the trach ties, which we do not use. We use the Velcro trach ties with instructions on the back. And then there are 5 cotton tip applicators that are great for cleaning really close to the insertion side of that trach. I always grab an extra set of 4x4 gauze just to help me clean around the site. With clean hands and gloves, we can go ahead and remove this dressing and we can check for any redness, anything that looks suspicious for infection to report to the provider. And then we're going to go ahead and get our kit ready. Inside, you're going to have some sterile gloves, a drape. This drape is shiny side up so that you can touch it with your clean hands. So you're going to open it, shiny side down, only touching at that inch border. Then you can dump all of your sterile contents onto that sterile field that you've created. The basin will be what you will soak your inner cannula in. You can open up your sterile trach brushes, place those in your bin. If you had a trach that had disposable inner cannula, you could open that up and have it ready on your sterile fields. To get our choice of fluid ready, pour a little sterile water into your basin for your inner cannula. And then you can also get these a little wet as well. Now we're going to put our sterile gloves on at this time. We are ready to remove this inner cannula. We're always going to want to support the flange of that trach as we remove. That can go in your basin of water. If you had that inner cannula that you were ready to reinsert, you could then grab it at this time and insert it. But we're going to say that we've got to clean this one. Cleaning the outside as well. If you had anything lodged inside of there, you could use some sterile water at this time to open up and then pour, cap dry. It's okay for water particles to be on the outside. We just don't want a whole bunch on the inside. and then we're going to reinsert that inner cannula at this time. The rest of this care is all outside, so we can use clean gloves for this. You no longer have to be sterile. Inside here, we're going to go ahead and just get our trach ties ready, or throwing those out, and take these cotton tip applicators, get them a little wet. And then we're going to go right close to the insertion site with a clean cotton tip applicator. And we're going to go around kind of like a clock. With our other gauze, this is a great time to go around and get that flange really nice and clean. And then with our dry gauze, we want to make sure that it's nice and dry. And then we're ready to do our split gauze and our trach ties. If you are not confident in your ability to do trach ties, I would always have an extra person with you. If you are ever removing, you've got to support this flange so that that trach doesn't come out. So having an extra person is a wonderful thing. You do have a couple of different dressings to choose from depending on your patient's trach. If they have pressure injuries, the lyofoam that already has the cut in the center is perfect for trachs. You also have additional split gauze that are available in your Walmart areas in case you need one, an extra. We also have a new product. It's known as Exoderm. It's also known as Duoderm, but it is a very flexible, flimsy dressing, but this is great for any of those kind of wounds starting to develop if it's pressure related. And this can also be great for as a barrier from secretions. Your choice here, depending on your patient's needs. Trach ties need to be changed once a day, and then trach care at minimum twice.